Black women have done amazing things to better our community. So guess what, Black women? We need you to do an amazing thing right now. We need you to do amazing work right now around the science of Black breast cancer. So I've been an advocate since I was 6. And a lot of the work that I do is to really try to advance the science.
The other thing is we do have data to show this integrated medical group visit model in cancer patients specifically, just not in African American women.
We don't have any black data, so we're just guessing. So think about it. For every 100 white women who die of breast cancer, 141 Black women die. Ward 8 has the highest mortality rate. I don't know if there's something in the water over there, but Black women are dying and they're not getting the care that they need. But that's when Dr. Regina built her clinic. So Regina Hampton, she went and fought to get funding to build a mammography center. And now it's a full a health center over there.
So Ward 7 and 8 have some of the highest mortality rates for breast cancer in the DMV area. And so what we found is that women in that area didn't have any good resources for getting mammograms. And so we felt it important to put it in the community. In fact, there was a lady that we spoke to who had to catch 2 buses and a subway just to get a mammogram. We tend to get breast cancer at younger ages. So our breast cancers occur under the age of 50 and more often under the age of 40, even before women are at the age when they would actually get what we call screening mammograms, which is recommended at age 40. Well, if you're 32 with no family history, you probably are not in that category of getting screened earlier.
Turn your feet toward the front as well.
Frankly, why the research is so important, because any chemo that you take as a Black woman is really a clinical trial in your body. Because we don't have data to show how it works in Black bodies, so when you take it, you're testing it for you. You don't know if it's going to work or not, right? So thank God they worked for me, but not for everybody. But that's why I'm on this mission to get more Black women into clinical trials. We have been basically excluded. Our physiology, our Black physiology has been excluded from research. And if you look back at the drugs, so there are several main drugs for breast cancer overall, which are the ones I took at first that didn't work for me. If you look back in history, they were all made like 20, 30 years ago. And guess what? How many Black women were in the clinical trials? 0. There were none.
What's interesting about the breast cancer in Black women in Washington, D.C., it's not an economic thing. And so when you look at some of the well-to-do communities in our area and some of the poorest communities, the cancers look exactly the same, which we're thinking that there's some genetic component. And so trying to get to that is going to take us as Black women getting involved in things like clinical trials, getting involved in work and helping to find the answers.
We don't want to die anymore. We don't want anyone to die. We need to advance the science. Black women deserve better science, better care, and better drugs. So do it for your daughter. Do it so you'll be here for your daughter or your granddaughter, or do it so they won't get it. I work for Belle, Leah, and Hart. I work for them every day. They are my purpose. And I got about 10 years before Belle gets boobs. She's 4.5. So I got 10 years to do this work.